So this is our bargaining and our CAT team, and I mean, I'll just go through some of the people. Like, this is a dental assistant. She's worked at Neighborcare for like 20 years. She's African American from Rainier Valley or Beacon Hill, and she actually, I think she went to Neighborcare, a previous version of Neighborcare. She went to low-income dental clinics in the community if it wasn't a Neighborcare iteration before it became Neighborcare. And she speaks eloquently about why she's doing this work. She is my neighbor and a PSR is a receptionist, and she's Lao. This is a Filipino social worker. This is a Somali dental assistant. She's an insurance verification person. This is an African American PSR. This is actually my ex-stepsister. Such a weird coincidence. So anyway, we reunited. We used to live together when I was 6 and she was about 16. And and this is a nutritionist. This is me. This is my medical assistant right here. So anyway, it's an amazing group of people, and we're all working together and doing really amazing racial justice work within our group, and also talking about doing racial justice within Neighborcare, because you know, the problem with racism is that everybody's saying that's just a KKK problem, you know, and it's really a thing that's inside of all white people, and, you know, people have internalized racism and all that stuff, and if we don't, like, kind of deal with it, it's just going to re-manifest itself in every organization that we put together. And that's even true on our bargaining team. Our bargaining team is probably more representative white and more representative privileged educated people than the whole organization. So we can go to the next one. And so this is the beginning. So in the beginning we had to, you know, keep it was all kind of underground. And so, you know, it was these people, you know, this was scary to be the first person on the program, you know, on the flyer. And I was really proud of these people to, you know, come out and just speak out in this, because we didn't have a union. We were just, you know, trying to get people to learn about the union and get involved. And, you know, a lot of people are from backgrounds, ethnic backgrounds, where in their home country, people get killed, you know, for being in union. So it was not an easy sell for some people, like, why should I do this? I could just quit and get a different job, etc. But our staff are so devoted to our patients. It is remarkable, and they could make quite a bit more money at other places. Currently, like, Swedish will pay like $3 to $5 more an hour and gives them like a $3,000 signing bonus if they quit. So now next. And this is just more. Oh, this is Joe Martin, very famous social worker at Pike Clinic.
I tried to get him here tonight.
Oh yeah.
But he's writing an article for Real Change, and he.
Okay. And this woman here and this woman here, these are two. She's an ARNP and she's a nurse, and she's actually an ARNP now. But they were both floats, and they were instrumental because they would float around and get everybody to join. This person. This was another situation where the boss was a great organizer. She works at 45th, and she had worked there for like 5 years and had a very large, successful panel. And visit volumes were down at 45th, and they wanted to, and we had an opening at Rainier Beach, and they told her to move to Rainier Beach, even though, you know, she like has a kid, she's a single mom, and they're like, she's like, what? And then she got upset, and then she got written up for being upset. So her colleagues really stuck up for her, and they didn't move her, and she got to stay at 45th, but that was another thing. That's the kind of way they treat us. They treat us like widget pushers. And this is not unique to Neighborcare. I don't want to act like Neighborcare is especially bad. And now you can go on to the next one.
Did you want to look at these?
Oh, yeah. Okay, so this is the, right, okay, great. So this is, go up to the top. And this was our big campaign that we did of doing kind of secret, we call them selfie signs. They're not selfies. We took these pictures of people, why they're voting yes for the union. Oh, actually, I didn't realize she was there. So and then after, so I think we wanted to get 50% of the people on board for saying they were committed to voting for the union before we went above ground that we were really organizing a union. So we did this to improve, what's the word, like, just so everybody, so people weren't afraid to say they were for the union, because when they saw this, that so many people were on board. And so look at this. This is really funny. This may not look funny, but one of the ways that we were able to organize the union was at our all-staff meeting, which is in October, and we went to the all-staff meeting and handed out lanyards at the door as people were going in. So the all-staff meeting almost looked like a union meeting. It was really funny. So you could just scroll up and you can just see how, so many different ethnicities are represented here. And it's really beautiful to work with people from this many backgrounds.
Are all these folks from the Rainier Clinic?
No. This is all of Neighborcare, which is 500 people.
Okay.
And here's Michael Lipman. I don't know if people know him.
Oh, yeah.
There he is. And then, so the next one is victory. We won by 75%, which is a landslide. Oh, a little bit of a thing to say before this happened is they tried to break us up into like 27 bargaining units.
Yep.
So we were able to bring it down to 2. So we're still in 2 separate bargaining units, but SEIU is very good about treating us as one bargaining unit. They strategize to only do one bargaining unit, just like they're doing for the Swedish workers, so that environmental services people and the nurses all do their contracts kind of together. So what were you going to say?
So which are the 2 units?
We have school-based, which is teeny tiny, school-based.
Yeah.
Like the...
Yeah.
School-based clinics, which is very few workers. Actually, of the school-based clinics, the providers, for whatever reason, did not vote to join. It's part of the reason, so it's a little bit of the thing, the boss is the best organizer, and the boss was not as good of an organizer of the providers, of the dentists, because they aren't under that same, pressure cooker of speed. And, everybody hears about burnout, it's because you're having to do things that you shouldn't be doing because you have no choice, because there's 10 more widgets coming down the line. So you're just like, okay, I'm going to go as fast as I can. You just can't
So is
keep it up.
this school-based and clinic-based?
Yeah, school-based and regular clinic.
Yeah.
But school-based are clinic, so. And then the next thing was, just trying to figure out what we were going to be bargaining for. We had things like talking about, like we did a survey that the union put together of what's more important to you, like wages, staffing, health care, et cetera. And I was actually really surprised that so many people didn't put health care, because our health care plan sucks balls. It's like $1,000 deductible and $500 a month. I'm like, what? So it's pretty worthless. But most of our staff are quite young, and a lot of them are on a lot of their kids at least are on Medicaid. So it's not.
But Tina, that's an issue in bargaining, right? The health benefits.
Barely.
Barely.
We're barely pushing that. Bargaining is more about wages is the really big thing that is hard. So then we kind of put together our contract proposal of having, for example, a 22-step wage scale, and so we all voted on that. So this right here is the we all had times that we could vote on the contract, which was sort of a rubber stamp. Who's going to say we're against increasing pay? So. So like, for example, right now, this is still happening. They can't get enough people to come to work there for the pay. We've just lost, I think about half of our nurses in the last couple of months. And they are hiring new nurses at more pay that just graduated from school than people who were working there for 3 years, So people find out, they get pretty dang pissed. So what we're doing is wanting to have a transparent 22-step wage scale, like first year, or with this many years of experience, you make this much for this job description, and you just know what your pay is going to be, plus a cost of living wage of it might be 4% a year. I really don't remember. So that because we have not even gotten to that part of bargaining. So,
Can I ask?
Yes, go
Is there
ahead.
a way to protect employees who have been there longer, who have more tenure, and who are moving into those higher tiers of income?
to protect them, what do you mean?
So that, if they reach a higher tier of income, that the management doesn't just lay them off because they're costing too much.
Oh, I see. Is that part of our contract? I don't think so. I don't think that is. Okay, so that was our main issues for bargaining. So we can go on to the next one. And this is more about different kinds of things about our bargaining, having a wage scale, having our paid time off be, it's a little bit too technical, but having a little bit more paid time off for people who have chronic illnesses. This is just about how our medical's too high, and we're doing what I think is a pretty trivial amount of reduced cost for people to have their kids on it. Because if you have your family on here, it's like $1,000 a month. Crazy. And then you have a huge deductible. So this is really interesting, this racial justice stuff. It's been really cool because, currently at Neighborcare, I don't even know where they get this stuff, but, we have these trainings that, they're online. They're just like, is it right to use racial slurs at the workplace? Click yes or no. You know what I mean? That's the kind of level of racial justice training that they do. And so one of the things that we have been doing in bargaining is because Neighborcare is a publicly funded organization, a lot of their information is public. And they do keep, they are by law required to give us certain information as well. So we have information about different racial groups by job class. And I wish I had this slide. I didn't bring that. It wasn't in this file, and I was going to keep a copy of it, but I didn't. So anyway, by job class, and it is what you see when you go into an organization like that. It's almost all white, a little bit of Asian at the top, and almost exclusively not white at the very bottom of the pay scale. And we can't just pretend that that's not happening and not address it, because it's a really big deal. So one of the things that we're trying to do also is have a education fund so that people can use money to go to school. And that will help poor people, people of color, et cetera.
Excuse me,
Yeah, go ahead.
it looks like you're the one MD on the bargaining team?
I am the only MD on the bargaining team, yeah. And I think, there's a few more, there's several nurses on the bargaining team. I am the only MD. There are several or mid-level, or what's the right word to call them now? What's the word they use to say? Not mid-level, they get mad at me when I say that.
Good question.
Uh-huh, go ahead.
I was wondering, depending on how long you guys have had MDs on, or depending on how much MD buy-in you've had when it comes to unionizing and helping workers unionize, have you noticed an improvement in the efficiency of the work of other workers or medical assistants and other workers within the clinics?
More efficiency, how so?
Or maybe that's not the right word, but more buy-in in the sense of like perhaps less burnout or more commitment, to where people see that the more or less kind of as an MD, you're put into more of a leadership position inherently. So as these folks are joining a cause to help make everything better, maybe workers are more motivated to kind of do their jobs or something along those lines.
I don't know about the other physicians.
Okay.
There are, we are in such a crisis. I think that we're going to have turnover data that will explain the crisis. So, at Meridian, when this is before we had organized the union, or just in the beginning of organizing the union, about 50, Meridian's a pretty big clinic out by Northgate, and where Michael Littman works, and like about half of the providers quit within a few months of each other.
So I work with Dr. Littman.
Oh.
I'm a medical student. And
I was a first-year medical student with him too, so that's cute.
So it's actually his last year teaching. So after 38 years, this is unfortunately I'll be his last student.
Oh.
He was telling me about the turnover. They've had, I think, 3 physicians turnover in the last year.
Yeah, it's crazy. And they don't have any nurses right now. They only have float nurses right now because all their nurses quit. So, and this middle picture here is us. So, you know, the way 1199 does their bargaining is because you have to be able to, you know, they say that like 10% of bargaining is in the bargaining room, but 90% is outside the room, because you sit there and you're going, well, yeah, we got the union, so you got to do what we say. And they're like, no. So the way you convince them is you put external pressure. So one of the things we did is we got everybody to sign a petition, go here. So they brought this gigantic petition to the administrative offices to show our support. And we always try to like get 70% or something like that. So this is how the union helps us strategize. So, you know, like people like our, a lot of times management is always trying to talk about it like the union's telling us what to do, like we're, you know, union bots and stuff like that. And everything we do is by consensus. The union leadership, of course, helps us frame our strategy and things like that, but they leave it 100% up to us, and we do it only by consensus. Even on things that really are sort of trivial, like how do you determine seniority? Do you determine it by how many years worked or how many hours worked? Like if you're a full-time person versus a half-time person, do you accrue seniority at the same speed, or does the full-time person accrue it twice as fast as the half-time person? And we, you know, debated that a little bit and, you know, came to an agreement. So anyway, so this is one of the ways we did the pressure on them. And then the next one over the pictures there, this is doing stickers, you know, having everybody do stickers and taking pictures and doing a flyer of stickers. So a lot of it is like playing on group mentality, you know, like that social science idea that there's like this small minority of people that are actors and do things that are outside of the herd. And then there's a gigantic chunk that are really just going to go along with what the majority does. And so they do use that priority or that principle. So this is Joe Martin's article. Wait. Horrifying reality that we live with every day. This is turnover data. And the RNs, it's way worse than this right now. Like my two nurses, that we still have two nurses at Rainier Beach, and we are so grateful we have two nurses out of three. And all the, you know, and so they did this annual salary review. You know, they do the annual salary review every year, and they tried to, in management, and they tried to make it look like, you know, oh, it's coming late because of the union. You know what I mean? They're always kind of seeding doubt and implying that this union is just causing all these problems. But they did the annual salary review, and many people got like bonuses of $100. That was it, no pay increase or anything. It was really bad. So, you know, I'm grateful that more people have not quit so far, and I'm just begging people, please stick around. We're going to be done with negotiating pretty soon. So this is part of the problem, is negotiating, like management has no motivation if we don't give them motivation in terms of external pressure to negotiate. They have nothing to win. They hired this attorney that is very good at sending out deceptive emails. And the longer they wait, the more people just quit. I mean, also that's not in their interest. I mean, I would think that this data here would be enough to make them want to deal with some, you know, pay issues. This provider, I don't think the providers are in it because of the money. I mean, the mid-level providers are probably underpaid. I mean, you know, it's hard to make it on their pay. But the MDs are not worried about their money, and they're mad because of the way they're treated.
So the main reason for people leaving the job is burnout? Is that
the provider one? The provider one or the other people?
Well, the RNs and
the RNs. You know, I'm not exactly sure. I mean, the RNs can make a bunch more money. And they're a little bit overwhelmed at the clinics, you know, because they have to go
The
so
workload
fast.
is too
What'd you say?
high. The workload is.
It's too much. Yeah, it's too much, and then more people quit, and then it becomes even more too much. So.
You need to hire more, in other words.
Yeah, exactly. Well, we've got like unfilled openings for days, I mean, because nobody wants to take the jobs.
What is the salary structure of management versus the providers? And is it
Well, that was-
transparent?
That transparent? No, that's one of
Does
our
anybody know?
slogans. What'd you say?
Does anybody know?
Well, that was one of our bulletins, and I'm just realizing I don't see that on here. One of our bulletins was, early on, was the difference between, not the difference, but the pay raise that Michael Erickson, our CEO, got. He's making $300-something thousand a year. And so anyway, that was a big part of also people voting yes, because they saw him getting a pay raise and making such a huge amount of money compared to all the other staff, including the physicians.
Have you noticed a turnover like in regards to different generations of employees? So I know, for instance, like with John and I, coming from kind of the more traditional millennial generation,
Mm-hmm.
we kind of we're growing up in an economy where it doesn't really make sense to stay somewhere for a very long time in regards to retirement incentives and any real upward mobility. So have you noticed any changes in that, and any ways to attract a younger crowd? Because there's tons of RNs coming out of school that want a job.
Yeah, but we don't
incentive.
pay very much.
Okay.
So they're like, And we do lose a lot of people when, you know, they come, they're very idealistic, and then they're like, wait, I want to not live in a small apartment for the rest of my life. I want to have kids. I want to maybe buy a house, and this ain't going to happen here. Yes.
Can we pursue this idea of, there's a lot, I'm sure I don't understand about the new environment, but some of us were, you know, founding members of portions of your now conglomerate clinic.
Yeah.
And we were on the board of, and so we were management, or we were, but.
You were management.
But you know, in the sense that turnover and recruitment, you know, advertising, recruitment, screening, training, all of that is a tremendous effort, and any employer who's got their head screwed on is going to want to try and minimize all of those costs and all of that activity. So I don't quite understand the position of the management that they don't care about. How can you run an organization if everyone's leaving?
Right. I know, it's sort of, it baffles the mind, you know, like how they could think that the current state of affairs is.
Well, take for example,
this
no
is their
nurses
data.
out at Michael's clinic.
Yeah.
What's
It's a disaster.
management thinking? What
Well,
is
what
their
they're
response?
thinking
You
is,
don't need
I
a
don't
union to
know.
tell them which way the weather blows.
Yeah, well, I know, I don't know, I don't understand, you know, they don't address that, and they just say, we're working hard to hire people, you know, and they did make a job offer to a nurse that was paid more, and she actually didn't even accept it, but they offered a job that paid more to a new grad nurse than our super excellent nurse that's been there for like 3 or 4 years. She came straight out of school. And she got a raise because she was getting underpaid, because she wasn't good at negotiating, because she's like, my last job was nannying. So she was like, wow, you're going to pay me more than $15 an hour. And so she was way underpaid, and they actually did raise her pay by quite a bit. But then she found an email, you know how you go down to the bottom of the email, and it wasn't intended for her, but she saw the job offer to a new grad RN that was like, you know, $1 more an hour. It wasn't a tremendous amount more, but it was just like, how can you do that? So they're trying to raise salaries for the new coming people, but then they don't want to raise everybody else's salaries to kind of even it out, and then it causes all this upset. But I think part of it is also they're just really very distant from the work that we do. You know, the other side of the bargaining team is all white, all make, you know, $200,000, $300,000 a year. And so they're in a whole different world. You know, they don't really, I don't think they get it from a being nice point of view. You know what I mean? I feel sorry for them.
They don't get it. You know, where I worked at Harborview, you know, I kept telling them, these middle management people, listen, if you want to contest my claiming of overtime, you should follow me around for a full day and see what I have to deal with all the electronic medical record,
Oh, yeah.
all the interruptions, etc. And you should follow me around and see what I have to do. And this is why I claim I don't like working overtime. I have to do it because I have too much work to do. And this is what these people need to do. These management people need to do is follow somebody around for a full day. Not just an hour here or an hour there.
Well, they do it, and then they're just like, let's do another study of, we'll get another manager.
Yeah, they said that to me too when I first started. I said, listen, I have 20 years of experience doing this thing. You think you're going to teach an old dog new tricks? I mean, no, that's bullshit. I mean, I know what I'm doing. I know how to do it. And you just need to see that you're creating all these infrastructure obstacles that make my job harder.
Well, and this is the thing I want to point out, which I think everybody who works in medicine knows, none of these problems are unique to Neighborcare.
No,
And
they're not.
unionization is the answer to begin real healthcare reform, because none of us, all of us know how horrible the insurance situation is. I mean, Obamacare, yes, it was great that a lot of people could just get insurance, and I could order CAT scans on people and not worry about them becoming homeless because of the bill. But that was only the very, very poorest. I have a patient right now. I have actually, it's insane. I have 3 patients who have thyroid cancer. All 3 of them, citizens, do not qualify for sliding fee scale. One of them makes $17 an hour and has 1 child, and I made sure that it wasn't a mistake. I talked to our chief financial officers. She is at 201/10% of poverty. So she does not qualify for any sliding fee scale. And so she has thyroid cancer. She doesn't want to come in because it costs her a few $100s to come in every time. And she can't afford the whatever bronze plan that's going to cost her like $500 a month for junk. It's like, what's the point?
Just a quick step back. When all this began with the call center and all that set off, was that just after the turnover of CEOs when Mark Secord retired and Michael Erickson started?
Yeah, no, this was all Michael Erickson's doing. But there was, and there's other stuff. This is the other transparency thing. Like, I think it was very close to the time. It certainly happened under Mark Secord's watch that there was like, I don't know, $20 million something missing because we didn't do something. I don't know. I'm just like, what? And then they just like, because of that, you guys have to go faster and see more patients without pay. It's like, how can they just say that? They do that. And there's no accountability and no transparency.
Probably, was that because they had to file a request for funds and they didn't file it on time? And
No,
so they
it's
missed
something,
the opportunity?
it's something
Because that's
about,
what that sounds like.
no, it was something about that we get paid some capitation for seeing patients, and then we didn't see as many patients of these capitated something or another's. And so, and it's because also this is all this placement, how can we be a community clinic when all of our patients live in Federal Way? A lot of them live in Puyallup, a lot of them live in Tacoma. You cannot have your primary care doctor in Seattle when you live in Tacoma, and they try to.
I have a question.
Yeah.
Why did they come from Tacoma and Federal Way?
Because, so that was what I was going to say.
What was the
Because they're
question?
from Seattle. They don't come from there as new patients. They come here, and then they continue to stay with us as displaced people who can't afford to live in Seattle. And, it's been interesting, the whole experience of watching the neighborhood become gentrified. Rainier Beach less so, but still quite a bit. I mean, Columbia City, we have a clinic in Columbia City. I don't understand where their patients come from. I mean, I don't know if any of you have been to Columbia City and the new PCC and all that stuff. So the clinic, one of our clinics is right there. I mean, this is the other thing, this is sort of changing the subject, but the medical assistant shortage is so bad that they are canceling people's clinics. Or they're having them see only 1 patient an hour because they can't you can't function without an MA, you know. So anyway, but, you know, when people are displaced to Federal Way in Tacoma, they still feel like they belong to Seattle. And they have this connection to our clinic, which includes our PSRs, our receptionists. And those relationships are really important. I would call them sacred. And so that's a big part of the union for me, is honoring those relationships, because we are not widget pushers. You know, the patients are not widgets. We are not widget pushers. I was thinking about the whole medical assistant thing, like how we could create some robot that you would sit in and it would take your blood pressure and, you know, with Google Voice, figure out what your chief complaint is, and it would do all the job of a medical assistant. And of course I'm against that. And how horrible would that be if that was what was that is the logical conclusion of our current medical system.
Stick out your left arm.
Exactly.
Put it in the cuff.
Right.
Put your finger out so you can put the, whatever it is on there.
You talk about the external funding sources for the clinic. And you talk about the need for external pressure. Have you, your crew, or SEIU considered going to whatever it is, the city, the county, wherever their funders are?
Yeah, you know, we've talked about this, and it's interesting that it hasn't, I mean, we have, there's a few flyers that have information about, we've had a lot of local politicians, progressive politicians, ranging from Shama Sawant to Lorena Gonzalez, and all these people who are involved in our funding and have, you know, made calls and things like that. But
Which part of that?
this bar graph that's on the very far, oh, there's Pramila Jayapal. Net patient service revenue. Oh, this is just documentation that we do have money. This is our revenues going up.
Yeah, but the problem is it didn't go up very much for the last year.
Well, they're always, you know, this is the problem, is they always are doing the sky is falling. The SEIU's financial lady who knows how to read numbers says that we're doing fine from what she can see. But if Neighborcare, you know, they haven't actually, they have not agreed to our bargaining, to our economic proposal, which is, you know, this wage scale and annual raises of 4% for cost of living increases and stuff like that. And we were assuming they were going to say no to it, but we're going to give us a counter proposal. And their counter proposal is barely even a counter proposal. Like, for example, they do have a little bit of a wage scale. I don't even know, they don't call it that, but like a medical assistant would top out at 10 years. You would not get any raises after 10 years. You would just get a 2% bonus, which would be just a couple $100 or something. So to answer your question, I have asked that many times, and it's not as straightforward. And I've never gotten quite an answer, I understand, but everybody says, no, we can't do that. And we cannot say you don't get your funding because you're so mean to your workers.
But just the political pressure. In other words, you can't cut your funding, but you can make their lives miserable in other ways.
Yeah, and we have been doing that. We went to their fundraising, their annual fundraising dinner, and we actually bought a table there. The union bought us a table, and we mingled with different political people, but there weren't that many political people there. Another way we're reaching out is currently we're trying to contact the people on the board to get their, because we are not allowed to go to board meetings. We're not allowed to talk to the board. So the board, of course, doesn't know anything about what's going on. I mean, hopefully they know that there is a union organizing thing going on and that was the reason we put the op-ed in the Emerald City Herald. I don't know if you guys saw the link of the article I wrote.
South Seattle Emerald.
Yeah.
Yeah.
Just
We put it.
made up a name.
Yeah, I think you read it, did you?
Yeah, if you click on the link, it's a little article about, it's in your guys' newsletter. It said you can read more about it here, click there, and then it'll go to the Emerald City Herald article that I wrote about the union organizing. And, you know, I was saying somebody should write an article about this, and they said, yeah, you should. But they did it with me, you know, like they had their communications person write it with me, so I wasn't too mean. They made me do it really, really soft so that Neighborcare management could save face.
Is
This
there
was
any,
this was about a month ago.
is there any legal requirement on their part, since you're a legitimate union and you've made a proposal, you speak for your employees, that within a certain period of this, or can they just stonewall?
They can stonewall us forever and ever, so that's why we have to put the pressure from the outside. So I had some thought about, anyway, I had some thought about what you were saying, but oh, if they really say, so they're insinuating they don't have enough money to meet our economic proposal, but if they really say, you will make us broke if we do this, they have to open up all their books to us from a legal point of view. That's what I understand.
How bad off can they be if they can pay their CEO $300,000?
Well, that's the thing.
Come on, and who are the other management people? How much are they making?
200,000, she says.
Yeah, I think
Yeah.
it's something like that, yeah.
I mean, come on.
I used to work at Children's.
Uh-huh.
And when I worked at Children's, I was in school at the same time at City University, and I was in the business program. And I used all these journals, and I had a lot of access to statistics because I worked in the Human Resources Department at the time. And I wrote an article about the cost of turnover. Because turnover is huge. And I actually submitted that paper that I did to my boss to kind of define letting valued, educated employees who add tremendous value to the job that they do by their experience and education, and then to have to replace them with somebody that you have to start from the ground up.
Yeah.
And so, I mean, it's phenomenal. It's like, it takes at least 6 months just to get them, to get a new employee to just be able to fit into the environment, to really begin to pay for the pay that they're actually receiving. And then if they keep rolling them over, and this is really true for professionals, but where you really lose is in those people, your PSRs and your medical assistants. Those people go rolled over very quickly. They cost a company all their profitability. And so I think you need somebody to crunch the numbers for them to show them.
I know,
how
it's
much
like,
they're
it doesn't make any sense to me.
Yeah, it's
that
not a
they-
good business decision to not pay attention to the value that your employees bring to the job.
That kind of
that they do.
turnover is a terrible cost, and it usually
It
indicates
is
something's wrong.
toxic.
It usually indicates something's wrong at the top.
Right. Sarah, it seems like you've got, you know, the potential for an organization that could just fail. I mean, you know, the clinic up at North, at Michael's Clinic, used to be a health department clinic.
Yeah,
It had unionization, it had scale steps.
Oh, that's right, yeah.
It had all the bureaucratic apparatus to allow and prevent these types of issues and the high turnover rate, and the cost, like you're pointing out, to all of that.
Yeah, it's huge.
And, you know, I don't know the history of what happened there. I would assume that the public sector, the health department, decided that they couldn't afford it, and they thought that the clinics could do it on the cheap. Well, it would appear that they can't do it, and you gotta
remember that
business
nobody
model that
cares
sounds
about
like
the people
it's
who are on
very
the bottom.
fragile.
You know, but nobody really cares about the patients we serve. And I'm not saying that, like, I don't care, or you guys don't care. But in terms of the people who are doling out money, they just want the pretty brochures and like, oh, look, you know, it's just all pretty talk. These people don't matter to anybody.
But if you look at the mission statement of Costco, for example, which is a business model that apparently is very successful and is run by progressive people, they understand that paying above the scale for their employees is what provides both content employees and minimizes all the costs of turnover. And that's their business model. When Public Health Service Hospital became PACMed, they prioritized their staff as second most important to the patients. And I just, from the days, Mark Secor's wife was the director of the Pike Market Clinic.
Oh,
It sort of seems like things have gone south real fast. But wow, it sounds like you got to be real aware of that business model there, because as was just pointed out, they could go belly up.
yeah, I mean, there is a, point where you're just like, there is a point that there's got to be a breaking point. And, my clinic, Rainier Beach, is much more stable for whatever reason. We have about 4 physicians. I've been there 21 years, but
21?
yeah. And there's another person who's been there, Marcus Rumpel. I don't know if you guys know who he is. He's been there about a million years. And then Raji Venkateswaran, she's been there, a year less than me. The other one next down has been there 2 years less than me, something like that. So then there's a little bit of churn in the mid-levels, but it's not that bad. We have pretty good provider satisfaction, and that's why we've been able to keep the nurses that we have, I think.
So we're in the Q&A period now.
Okay, all right.
Has SEIU organized any similar organizations to yours? Be it in
Oh, you mean
Seattle or-
community clinics? So did I say, I think this is the only one that's ever been organized that is who?
CMAR.
Do they have physicians?
See,
I mean, I
don't-
know they have physicians. Do they have physicians in their union?
I don't think so.
Uh-uh.
So this is you're talking about the only wall-to-wall?
We're the number one.
Yeah,
We're
yeah.
the first.
Well, actually, Pike Market.
They don't have a union. They
no,
tried.
No, they did. They got it off the ground,
Ah.
and then they were absorbed into Neighborcare, and
Yeah.
it fell apart.
Yeah, and we
But
tried to
they had-
continue
they-
that union.
I
but it
also
didn't
tried to
work.
get Les Piddle here, who was a
Right.
longtime
Yes.
doc at Pike
Yeah, yeah.
Market, and Joe Martin,
Uh-huh.
social worker there, because I wanted
Okay,
them.
we're the first one that actually got
Yes.
a vote, a yes vote, and we're like a real union, and it's really cool. And so, but there is one that I've just heard about that just voted, and I'm pretty sure, I just learned about today, in Philadelphia, and it is a SEIU bargaining unit, and management is trying to say that physicians are in management, and they cannot be in the bargaining unit. But because I read that part, there must be physicians in this union. So they're the second.
No, this is a tremendous breakthrough. Pike Market they were in the process of negotiating their first contract
Uh-huh.
when they got absorbed into
And it was going to be
Neighborcare,
physicians too.
and there was no more union.
And it was going to be
Yes,
physicians too.
it was.
Yeah, uh-huh.
It was.
Yeah. Oh, so they actually voted yes and
They-
were about to negotiate their
They were
contract.
negotiating their first contract,
Oh, they were
and then the
where we
whole
are.
thing crashed.
Hopefully Neighborcare doesn't go belly up before we get a contract.
So,
Erase that.
No, I was an organizer with 1199 at that time.
Ah.
And I had long history with Pike Market Clinic and the community clinics generally. And so I was assigned to spend some time with the folks at Pike Market as they were getting their contract bargaining together. And, and then that's what happened. They got.
No, I remember that, and I was involved in that, trying to, but I wasn't deep in that whole thing, because it kind of, just as it was I remember we went and tried to find the board meeting and run in there and tell them what we
No,
thought.
this is a real breakthrough,
Yeah.
what you guys did.
so could you just summarize where you are now? There is a union
Right
that's
here.
been voted in, and you're working on your first contract.
Mhm,
But
yeah.
you're having, the typical
Yeah, so
bargaining
we're
problems.
in the escalating more. So we're have a current more photographs and of people with signs like saying things like transparency, retention for job retention, stuff like that is why we're in the union. And eventually we're going to get to the point where we're going to do informational pickets during people's breaks, because Neighborcare has a really good reputation in the community, whether they deserve it or not, and they really protect that, and they're able to recruit a lot of people because of that reputation.
So at that point in time, you're gonna be asking people like us to come out and
Yeah,
to
Yeah.
support the informational pickets, which
yeah,
will
yeah.
sooner or later might be obstruction.
Well, and you know what? Tomorrow I'm going to speak at the informational picket at
Swedish.
Swedish, yeah, I'm pretty excited. I'm going to speak for 2 whole minutes.
Between 4 and 6 sometime?
5:15 to
Excellent.
5:17.
So,
So
speaking of,
could you just talk about that, so
Oh,
people,
there will be
about
an
what's happening?
informational picket at Swedish. At all the Swedish campuses from 4 to 6, and the one that I'm going to be speaking at is the Swedish First Hill, and I haven't quite figured out exactly where it's going to be, but it's
Broadway.
somewhere on Broadway.
It's on Broadway,
Oh,
right,
okay.
right in front.
Okay.
Oh, wow.
Who's picketing? What's going on?
Well, and this is the thing that's really cool about
SEIU.
1199.
Who are they organizing?
It's everybody. That's what's cool
community.
about, look, just a second, let me say. It's, 1199 is up for 5 different contracts, and what's cool about 1199 is that they do the contract of the nurses and the environmental services, which is the new word for janitors, all in the same, they treat each other as one bargaining unit, which is beautiful because, you know, for example, at the UW, my husband is in environmental services at the UW, and, you know, they have a crappy contract and the nurses have a totally different union, and it's, you know, the nurses are getting really great raises and the environmental services people are getting paid way less, of course, and they don't get a raise. And so it's really beautiful to see that solidarity. And this is, you know, we are all providing vital services, and you cannot say that the janitors don't matter. They are part of infection control. You can't say that they're just, you know, taking out the garbage. They're doing something really important. My husband talks to the patients, he cheers them up, that he's part of the team. And to make it that they're not as important as the doctors is a lie.
Is this a new contract or an existing contract that's being negotiated?
It's a recurring contract, and so for whatever, I don't know what the sticking points are, but it's apparently going poorly, and now it's escalating to an informational picket.
have there been any, I guess, reasons to go via social media? Considering the
Yeah, we
size
have a
and
little
power
bit of a
staff?
social media presence, and you know, because Facebook is so evil, I have not really gotten deep. I do have a Facebook page, and I've posted a little bit of stuff on there, but I'm not really that involved with it.
Can I ask, so what's the significance of tomorrow? Is there a board meeting tomorrow, or is it just a
The S-
date that works for everybody else? Or like, what's the significance of the date?
You're talking about the informational picket? Oh, I don't know why, so this is for the Swedish healthcare workers, the nurses, environmental services. There's 5 whole contracts. I don't know what all the people is. I mean, it's probably CNAs or whatever they call a CNA now. They keep on changing all these words. And there's 5 different contracts. They're all maturing at the same time and all in negotiations, and 1199 Northwest treats them all as one contract. So that's what's really cool. So I guess so I can speak to how we do it in our clinic. So the school-based and us are 2 separate bargaining units, but we function in our meetings as if we're all one bargaining unit. So we're going to have the same healthcare.
You're at the same table, bargaining table?
It's totally
Yeah.
same bargaining table.
Yeah.
So I wanted to ask if SEIU is representing you as your union reps. Would they then not go to your management and bargain for the things that you see that you need?
Well, I don't
So
get what
in-
your question is.
Well, I mean, I think that's what a union does, right?
Well, we're bargaining
You're-
for ourselves.
You're union members.
Oh, our union
But-
members.
But, right, you have agreed that you're going to be part of SEIU union.
Yeah.
Right,
Mhm.
and so they represent you.
Mhm.
And so do they not now go to your management and state your case for
Mhm.
the things that you are concerned about? I think that the part.
Well, they state our case, so how a union meeting or bargaining meetings works, the room's very similar to this. And it's all of us, those people in the first picture, in the room, and then the 3 people from management and their lawyer. And we have this, contract proposal, and it's very long and boring, and the lawyer and our negotiator are the only people who generally talk.
Who's the negotiator? Is it an SEIU person?
A SEIU person, yeah.
Okay.
And he functions as in the same way the lawyer does. But then we have our meeting, just like management has their meeting with their lawyer to decide what our position is. What we're saying is acceptable, what is not acceptable, et cetera. But then the only people that actually speak in the meetings about negotiating, but we don't negotiate in the meetings. We say, each side says its piece, and then we do caucus separately as 2 separate sides of the bargaining team, and then we
Come together.
and then we come back together and say yay, nay. So we've had, oh my God, this is the thing, that management is being really irritating. Like, we haven't even gotten to the economic proposal. We're arguing over bulletin boards. We got the bulletin boards. But we got the right to have a bulletin board in the conference rooms of all the clinics, but they didn't want to let us do that. I think we're still arguing over whether they're going to do automatic deduction of union dues. They're like, we don't do that. You can do that on your own, But I mean, it's like a.
Get a brown paper bag and everybody puts in 50 cents.
Yeah, exactly.
If I could comment on Kathleen's question, one thing that 1199 does very, very well, and I respect them tremendously for it, and I was involved for 8 years in doing it, is there are not 3 parties. There are 2 parties. There's not the union, the workers, and the management. There's the union and management. And the union organization provides a negotiator and provides staff support and organizers and what have you. But 1199 does a very good job of making sure that when the union speaks, it's the workers organized in the bargaining team in all the things that they do leading up to bargaining and supporting the bargaining. So to the extent possible, 1199 tries to make it clear all along the way that there's only 2 parties. Because one of the things that, historically management does in order to weaken unions, and which a lot of unions historically have played into to their detriment, is they're the union officials and they're the union. And they bargain for people,
Yeah,
and they collect the
exactly.
dues and et cetera. So this is, the 2-party model as opposed to the 3-party model is one of the things that I think is very important here, in which the way Tina is describing it is a perfect illustration of that, of how they're doing it. There probably will come a moment when you guys are calling for community support on a picket line or something, right?
Yeah.
Well, one question I wanted to ask is, how do you place this within the context of national health care reform or state health care reform? Are people cognizant of things going on like Pramila Jayapal's bill, and do they have any time to work on it?
We've had Pramila come, and I'm pretty sure if you ask anybody on the bargaining team, they would be for universal health care. But that is not a big subject we discuss in our meetings. But I feel confident, based on my own emotional response to this, that no healthcare worker wants the current system we have. We know that insurance companies are the enemy.
It doesn't work.
Yeah, it's like big business and taking care of poor, vulnerable people does not mix.
There's another element, I want to just throw it in here because it's really important. September 30th is the date by which the federal funding for community health centers has to be reauthorized, or the community health centers around the country will lose a huge chunk of money. And one of the things that SEIU is also very good at is, on the political front, forming alliances with the employers wherever possible to advocate for the public funding for the program. So in this case, the community health center funding. And it's obviously not what you're bargaining about right now, but I'm sure that that's going to come up along the way somewhere, because that has to be reauthorized, or there's going to be a world of hurt
Yeah.
in the community clinics.
Yeah.
Is that set by HHS or is that set by a?
No, it's legislation that has to be reauthorized. It was reauthorized 2 years ago, and it expires September 30th.
Yeah, but who authorizes it?
Congress.
Congress.
Congress, okay.
Yeah.
No fooling around with that one.
I kind of wanted to ask, so I imagine that a large majority of the patients that you serve rely on Medicaid as well. So how does that, how does your clinic and jive with like Medicaid, and do you see a lot of issues there, or?
Meaning, I mean, there's plenty of issues. I mean, like, for example,
Do you guys turn patients away if they aren't able to?
no, we don't turn patients away, but we send them to collections. So that's pretty bad. And we have sent, this is one of our union things, is that like 70, 90, something like that, of Neighborcare workers were sent to collections last year or something like that. Yeah, our own staff got sent to collections.
But-
So,
To qualify as a federally qualified community health center, FQCHC, part of the deal is to get the federal money, you cannot turn anybody away, regardless of their ability to pay. So the community clinics are the safety net that are federally funded with that stipulation that you can't turn anybody away.
but you can send them to collection, and you
Yes.
can charge them $300
Yes.
a visit.
Yes.
So, I mean, and I don't want to focus too much on those people, but because I think that would happen to them anywhere they went, because they make more than 200% of poverty, and $17 an hour with a kid in Seattle is poverty. There's just no other way to call it. And I spoke to our chief financial officer about this, who was on the other side of the bargaining team, and, you know, she didn't have an answer about what to do about her. You know, there's no, we just like pretend it's not happening. That's our policy.
What was the statistic about how many people are sent to collections?
I think it's like 70 or 90. I can get it for you.
Of your staff?
That was in the workforce, right? Yeah.
As to what you're saying, it has made my morale much better. Yes, it has made my morale much better.
And your father is smiling down.
Yeah, I know. Oh, God, I got choked up at the beginning of the meeting.
You know, Tom Warner gave his car, and we had the Mass Health doctors or somebody, we were on
Yeah.
a cavalcade from Federal Way up here, and we were in a parade on I-5, and came off I-5 and on 45th Street, or the 45th Street, I think, and he rear-ended somebody, and his car got totaled. He was on a PNHP mission at that time.
Oh, okay. So,
So-
you mean he donated his car, and did he crash it, or did?
No, he crashed it.
Oh, he
I don't know what
crashed his own
happened
car.
after that, but I know it was totaled.
All right. Well, thank you very much for having me.
All right.
Okay. Bye-bye.